name's Catherine, I'm a PA student, and today we're going to be doing a genitourinary exam on our model. So first things first, I washed my hands and I put my gloves on early, otherwise I can't get them on for the video. So first I'm going to make sure that I introduce myself and identify my patient. So hi, my name is Catherine, I'm a PA student at Westfield State. Let me confirm your name and date of birth. Perfect. I'm going to be doing a genitourinary exam on you, which involves inspection and palpation of your penis, scrotum, and a digital rectal exam. Is that okay with you? Okay. And would you like a chaperone? Now that I've obtained consent, we're going to begin my exam. So I have my patient positioned appropriately, undergarments removed. So the first thing I'm going to do is I'm just going to inspect the area around the penis. So I'm looking for any lesions or any signs of trauma, anything out of the ordinary. So then to begin the penile exam, we're going to lift up the penis, and if a prepuce or foreskin is present, we're just going to retract that back. So we're making sure that it's able to retract, checking for phimosis or paraphimosis. Then we're going to inspect the glands of the penis, looking for any ulcers, indurations, tenderness, anything like that. Then we're going to look at the location of the urethral meatus, checking for any discharge. And then also we can give the glands a small squeeze to check for any discharge that way as well. Then we're going to palpate the glands, checking for any tenderness or anything like that. Palpate up the penile shaft, looking for any tenderness, induration, any plaques, any fibrosis. And then while the prepuce is still retracted, we can go ahead and palpate that as well. We're also checking for hygiene during that. So now we're going to go ahead and put the prepuce back in its proper spot, and then we'll do the scrotal exam, which I have separate for the model. So first we're going to inspect the scrotum, looking for size and symmetry. They should be equal-ish sizes. Usually the left is a little bit lower. We're looking for any lice, nits, any tortuous vessels, any signs of infection, anything like that. Make sure you also look at the back. And then to continue the scrotal exam, we're going to go ahead and palpate the testes bilaterally, looking for any masses. They should be smooth, firm to the touch. And then we're going to palpate up to where the epididymis is, and then palpate up the spermatic cord, looking for any pain or tenderness or anything like that. Once we get to the top, we will then go into where the inguinal ring is, which is on either side up here following the spermatic cord. Checking for any hernias. We can have the patient turn their head and cough, and we'd be able to check for direct or indirect inguinal hernias. Once we have done that, we are going to, if there were any masses, let's say there was a mass here, we would make sure we could palpate above the mass. And then if any masses were present, something we could do is we could use our stethoscope to auscultate, listening for any bowel sounds that might be indicative of a hernia. And then we also can use our pen light to trans-illuminate the scrotum. This model won't do it, but if they had a hydrocele, it would light up. So that concludes the first portion, or the penile exam.